My name is Terry Ketter. I'm professor of psychiatry and chief of the Bipolar Disorder Clinic at Stanford University. And want to talk a little bit about use of anticonvulsants in bipolar disorder. Probably one of the key things is that the anticonvulsants are highly variable in their beneficial and side effects. And only about 10% of the marketed anticonvulsants in the U.S. have indications for treatment of bipolar disorder, and maybe another 20% have some utility in comorbid conditions like substance use, migraine, anxiety, pain. So that leaves like 2/3 of them possibly without a use in bipolar. So you cannot assume that an anticonvulsant is useful in bipolar disorder. So the ones with indications are divalproex or valproate for acute mania, carbamazepine for acute mania, and lamotrigine for preventive treatment. And the sort of the son of carbamazepine, oxcarbazepine, has some data that is encouraging, but it's an underpowered study and it didn't separate from placebo, so we're not quite sure about that. So the two medicines that are approved for acute mania, they have side effects that are sort of somewhere between antidepressants and antipsychotics. So a little bit harder to take than antidepressants, but a little easier to take than antipsychotics. Lamotrigine, which is approved for preventing episodes, has tolerability that's by and large pretty similar to the antidepressants, so it's got pretty good somatic tolerability. The problem with lamotrigine is it doesn't seem to work in acute bipolar depression, and it's better at preventing depression than turning around an acute depression. Valproate has three box warnings. One of them is for liver toxicity, and another one is for birth defects, and it may actually be a little bit worse than some of the other ones with respect to birth defects, and another one for pancreatitis. That being said, probably the commonest disincentives to use these medicines are other things than the boxed warnings. So with carbamazepine, I would probably consider it to be the drug interactions. It decreases metabolism of multiple drugs, so you can't be really sure that these other medicines are at sufficient blood levels to do the job. And with valproate, some people get sedation, some get weight gain, some get tremor. It doesn't seem to have the metabolic challenges that the antipsychotics have, but it does have a weight gain issue. Carbamazepine, it's got a low propensity for weight gain. It's generally, most patients don't have problematic weight gain with carbamazepine.